This is a recording of Dr. Tom Roselle Live for Sunday, January 16, 2011. You can listen to Dr. Tom Roselle Live every Sunday from noon to 1 p.m. right here on 630 WMAL.
Welcome, everybody. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I am live in studio here at 888-630-9625, 888-630-WMAL. Love to talk to you on any subject that you have in mind. Perhaps you've had a problem and you've tried, you've applied, and you've come up with the same old, same old. Not a whole lot that works. Well, this is your opportunity. This is the place that you call, 888-630-9625, to find out how to do it differently, without drugs, without surgery, an application that you may not have thought about, and I can show you why what you're doing may not be the best approach. We're going to talk about an interesting subject today. Many of you have had problems with over a period of time, and one that unfortunately in many arenas traditional allopathic applications fail to cure, and we're talking about Lyme disease. Lyme disease. It's a nasty bugger. Many people think that it's far more deadly than what we're thinking about. It's infectious. It's contagious. It's something that you just don't get from ticks. And we're going to shed a little bit of a different light on the subject. I want you to understand how much of a problem it is. But more importantly, today we're going to talk about a very interesting application of biophoton therapy as one of the things that seems to be making a very interesting headway into treating this deadly problem. 888-630-9625. And why do I call it deadly? I call it deadly only because of the fact that it can shorten your life if it's not treated properly. Does it kill you? No. Your morbidity, the way you lead your life, the way you feel, the symptoms that you have and so forth, it's profound. And you need to know that there are options. There are things that you can possibly do to make a huge difference. You know, a wealth of valuable information is always important in anything that you do. And there are a lot of different physicians out there. Matter of fact, the jury's out on Lyme disease from 1,000 different points of view. And one of the people that I have a lot of, I'm not going to say that I look at him as the go-to person, but has had the capacity to do a lot of research. Is a medical physician by the name of Kenneth Singleton. He's author of a book called The Lyme Disease Solution. And so much of what's out there is a matter of clinical application. Does it work? Does it not work? Is it effective? Can it actually turn things around? Those of you who've suffered with Lyme's, who've been diagnosed with Lyme's, who know people who've had Lyme's disease, know that this is a situation that can just knock people right down the tubes. It can include the symptoms of pain, fibromyalgia, toxicity, and fungal problems, and infections, and allergy reactions, and sleep disturbances, and hormonal problems, and autism, and chronic fatigue, and just not, your body just doesn't work. It's an unbelievable, devastating situation. It started as an infection, supposedly, from a tick, and a deer tick. And the prodromal, the identifier, is this big bullseye rash that occurs from the place that the tick bites you. Well, Lyme's is basically a spirochete, and the spirochetes are destructive microbiological predators, and they can really do a number on anything in the body. But they can affect the brain as well. They can affect any of the organ systems. There's significant cross-contamination. Now, a spirochete, to give you an idea of what this is a cousin of the same little bugger that can cause syphilis. It's not syphilis, but it's the same microorganism that infects people in that type of situation. There's many types of treatments, from just straight antibiotic therapy, very, very strong antibiotics, to natural applications, and some of them work and some of them aren't even worth mentioning because they just don't work. The biggest problem, in my opinion, with Lyme's is that most physicians are stuck utilizing a blood test, Western blot test, that only identifies a few of the markers with Lyme's. And unfortunately, a lot of physicians also will come up and say, listen, you've only got one of the markers. You're not really showing a lot of symptoms, and this may not be a problem. Let's just watch it. Bottom line is, if you have one marker or you have 10 markers, you have a positive Lyme's indicator, and it has to be taken care of. It has to be treated. And it doesn't have to be treated necessarily by medication or drugs, but it has to be treated. The problem is that over time, as the immune system in many of us will begin to drop down, we begin to see other problems. We see neurological problems. And neurological problems very much like and akin to the symptoms that are produced with MS or early onset dementia or Parkinson's or any of those types of things, and tremors and the like. They're one of the most common co-conspirator, if you will, is a bacterium called Babesia, and it's one that sometimes can be treated very effectively with antimicrobials, but often doesn't do the job. And unfortunately, when people start getting huge amounts of antibiotics, IV antibiotics, for years, 3-4 years at a time, it just destroys the rest of the body. It knocks out all the good bacteria, all the immune functions that you need to fight other things, and subsequently, you end up with other problems that are a result of the therapy, and they don't work. There's a problem with Lyme's in that it mimics so many other different types of presentations within the body. And that's what we want to talk about, not only, why treatment fails, and that's the problem is that we don't identify it. I've read extensively on the area, and we treat Lyme's from a natural point of view using natural herbal preparations like artemisia and teasel root and so forth, and we use low-energy light laser, and we get some effective results where other practitioners seem to miss the boat sometimes. But what's important is that you identify the Bartonella, which is the Lyme's microorganism, and any other associated microorganisms like Babesia, and there's several others that we call hitchhikers. They're co-infectors, and you set the body up, one, to be able to turn its immune system around, but also to be able to restore function. Let's talk a little bit about what really happens. And by the way, for those of you who like to do research, there's an interesting book, and I think it's available on Amazon as well. It's called Lyme Disease and Co-Infection, and just go on to Amazon.com and you'll be able to find that. Much of this, by the way, you can follow. After I get done today, I'm going to blog on our website, actually through Facebook and our business website. Go to rosellecare.com. That's ROSELLECARE.com. And then you're going to see a link, and it's going to say Facebook. And click that. You don't have to be a Facebook member, but you can go right into our area. And there's a whole blog there that we try to do ongoingly. And you can be notified when we post something and so forth. And we're going to do something with this today. But Lyme disease or boreolis and other types of conditions can be treated very effectively in a lot of different ways. So we're not going to talk about the things that can't be affected, although if you'd like to know about those, you can give me a call here at 888-630-9625, and we'll talk about that, or anything else that happens to be bothering you. But there was an interesting study out of Germany, and a medical physician by the name of Ingo Wiltzel, and he's a guy that graduated from not only medical school, he's got training in naturopathic medicine, environmental medicine. He received a Master's of Chiropractic certification from Ackerman College of Chiropractic in Stockholm, Sweden, and so forth. Interesting thing is that he's a specialist in treating Lyme's or boreolis, and his treatment approach is very, very unique. He treats Lyme's with something called photon therapy, and he started this a whole lot of years ago, probably 9-10 years ago. And he's noted in his patients, which is highly unusual because many patients relapse dramatically, only a relapse rate of about 3%. Now, biophoton therapy is a cousin and relates to the old Rife frequencies and also to what we use in low-level lasers and how they affect the body. It's an extremely important contribution to the area of treating Lyme's, in my opinion, because this type of, if you will, electromagnetic light quantum mechanics, it's something that affects all living organisms. And what you need to know is that all living organisms emit a energy level, if you will, from its cells, and that energy level communicates with each cell in the body. It's kind of a very interesting interchange, but we all have it. And there's two frequencies that a healthy cell emits. One is 460 nanohertz, the other one is 635 nanohertz. Now, as long as cells vibrate at those frequencies or between those frequencies, life is good. Everything works the way it's supposed to. When it doesn't, you've got a problem. So we're going to talk about that and how it applies to Lyme's. Now, the thing that you have to remember is a lot of people get Lyme's exposure. Not everybody gets Lyme's. The same thing as a lot of people get HIV exposure. Not everybody gets HIV. A lot of people get herpes exposure. Not everybody gets herpes. Why is that? Well, there's a common truth between all of this, and we're going to talk about that and talk to that subject. But before we do that, let's go to the phones. Jamie from Arlington, how can I help you?
So we're going to talk about that and how it applies.
Jamie?
Yes,
Hi, turn your radio down so you know when I'm talking to you.
I do.
Okay, thanks. How are you today?
Oh, fine, thanks.
Great. How can I help you?
Dr. Roselle, would you agree that drinking a half a cup of wild blueberry juice can help your memory?
Well, blueberry juice, just like anything else, is an antioxidant, and it can affect a lot of different things, particularly your eyes, and a lot of degenerative oxidization throughout your body. So specifically for memory, it's not something that I would use all by itself, but it can be useful. Is there a reason that you're asking? Do you do that?
Just that I heard a natural health program mention this.
Well, it's a very high antioxidant, and again, it's often been used for vision and other. In addition to other things, there's no one piece, there's no one panacea. Generally, for memory, you're going to use vasodilators like niacin, or you're going to use ginkgo, and you're going to use NAC, you're going to use taurine, things of that nature, B12 with folic acid, very high levels. Those are actually much more effective in restoring cognitive function than using this. But having said that, you want to use any kind of very significant, good, pure, organic, natural antioxidizers. So blueberry juice being one of them, but it's not something that I would say would be the end-all, be-all. Just it can be part of your regime as well as other things can be. Acai juice and so forth. We thought acai juice was this new miraculous thing. It's not. It's just a piece of the puzzle.
Mm-hmm. Can I ask one other question real quick?
Sure. We've got about 30 seconds. I'm going to take a break.
Is chewable vitamin D3 as good as the other?
It depends on the manufacturing process. It depends on the suspension, how it's made. So the short answer is possibly, and how much of it you're taking. We use oils and we use suspensions. Biotics Laboratory makes one called that we use. It's a vitamin D suspension, and then we use oil. Some people are sensitive to the soy that's suspended in it, and you have to do something else. Cataplex D from Standard Process Laboratories also is very, very effective. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I'm here at 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject you have in mind. We're discussing some of the clinical applications and treatment of Lyme's disease, particularly one that was brought about 9 years ago or so by a physician in Germany by the name of Ingo Wurzel. And he has significant credentials, not only as a medical physician, but a naturopathic physician, environmental medicine doc. He also has a Master of Chiropractic degree from the Ackerman College of Chiropractic in Stockholm, and he treats Lyme's as well as other conditions, but is known as a specialist in that area. And we're just discussing his application. It's very similar to some of the things that we utilize. We see patients who come in with profound pain that hasn't been alleviated by any other method, and subsequently it turns out to be Lyme's. And many patients come in with a diagnosed Lyme's condition. Some patients know that they have, and they've been treated with IV antibiotics for a long, long period of time. The problem, in my opinion, with treating antibiotic or using antibiotic therapy for Lyme's is a lot of things. However, let's talk about it for a minute. People with Lyme's frequently observe that they get better. They get positive changes when they use antibiotics.